My name is Kayla and I will be showing y'all how to do a ultrasound guided IV. The reason that this skill is performed is for veins that are hard to access, that are not visible or palpable, and after 2 failed attempts. The people that are able to do this are the RNs, physicians, advanced practice, clinicians, and other licensed, certified, or trained personnel. Equipment that you need is non-sterile gloves, ultrasound machine, antiseptic to clean the machine, sterile probe covers, the gel for the machine, antiseptic agent to clean the skin, a tourniquet, and IV. Usually it's typically a 20 gauge IV. Transparent dressing for after the IV is placed, and also have available a flush and materials for the patient education for afterwards. I will be taking you step by step as to how to perform an ultrasound IV. The first step is always hand hygiene, so I have some Purell here. I'm going to dry these a little bit because it takes forever to dry. You want to have two identifiers for your patient. So I usually say ask them their name and date of birth. You want to provide privacy for the patient, and you want to introduce yourself to the patient and the family member if they're in the room. You want to explain your role. You want to see if there's any language barriers and or deafness. You want to explain what you're going to do and why you're going to do it, and explain the ultrasound machine because sometimes people don't understand what it is, and answer any questions that they have for the nurse. Alright, so the first thing you want to do is to find the site. So you would clean the area and use your ultrasound probe, which is my spatula for today, and you would put a probe cover on it and clean it, and you would find the site first and then mark the areas. Like for instance, if it was around this area, I'll mark the top and the bottom, and then use the probe in that area to figure out where the vein is before, and then you would clean the area that you're in, your site area, beforehand. So, but since we're not going to do that first, I'm just going to pretend like we've already got our site marked, and we're going to say it's like right here. And so I'm going to clean about 3 inches in a circle of that area. Right? And then you would place your probe, and I'll show you a picture in a minute of where you can see the vein, and you would using your non-dominant hand, you would hold your probe, which this is my dominant hand, so it's not going to work out that great. But you would put your probe on there so that we can see the veins. And you need to know the difference between a vein and an artery. Veins are squishy, and they will, once you push down on the probe a little bit, you can see them where they collapse, where arteries do not. And arteries pulsate, so that's another sign that you can look for. So you would find your vein, and you have 2 different ways you can do it. You can do it transverse, or you can do it longitudinal. Transverse, when you see it, it will only be like a little dot on the screen, so you can see the dot for the needle when you actually go in. Whereas, longitude, you'll see like a longular, you'll be able to see the whole needle pretty much. So I usually will say we'll do transverse, so we'll do it this way, and then you would take your needle, which I have a pretend needle, and I'm not going to be able to hold both, so, and you would take your needle, and you would find your site, or wherever you cleaned, and you would go in. As soon as you see the needle tip inside the vein in the machine, it would look like a circle with a little dot in the middle of it. You know that you're inside, and then you can start advancing it, and you would have to take your non-dominant hand with the probe, set the probe down, and then hold the hub so you can advance the catheter into the vein. And you can see all of this on the ultrasound once it's all done to verify. So like I was saying earlier, I have an image here that kind of gives you a better description of what it would look like. But yeah, they're holding the probe in their non-dominant hand right here, and then holding the needle in their dominant hand right there. And so you would hold the probe, and you can see on the screen either whether it's a dot or the vein itself, how long it is. And then you can see that as you insert it. And so as soon as it gets into the center of the vein is when you start advancing the catheter and holding the hub. I also have another image here. Like I was explaining earlier about arteries and veins and knowing the difference. I don't know if you can see this very well, but arteries and veins, see the difference? And so when you squish down the veins, they'll collapse together. That's just kind of how you tell the difference. Very good. And then this is another view of the needle that you can see. Some common mistakes that are made are the nurse has to go in there with the knowledge of anatomy of the vascular system. They have to know like which veins to use, what veins not to use. For instance, the brachial vein is not preferred because of where it's at. Obviously, they're going to be bending it, and it's going to be hard, and it may or may not last long. You also need to know what they look like on the monitor. So veins and arteries will appear black, like the picture I showed you, whereas the tissue will appear gray. And then it also found out that nerve bundles and the bundles of vessels will be dark to avoid them when cannulating a vein. You need to know the difference between the veins and the arteries, like I was saying earlier, knowing that arteries do not collapse and veins do. You need to know that you avoid using the arm that has either dialysis, infection, edema, rashes, or any abnormalities, because that could cause a problem later. And you need to know what can influence veins. You're selecting veins. You need to know about the diameter, the depth of the vein, whether it's straight or curved, superficial or straight. And you need to know how to pick the correct IV. So it's based a lot on age and size of the vein. The vein should be at least 3 times the diameter of the cannula, and you need to insert it at a 45-degree angle. Otherwise, it can bend. The cannula can bend when it comes close to your skin. It can bend and can influence whether or not it goes into the vein. And lastly, I want to go over some complications and risks that are associated with IV insertion. You need to be educated on phlebitis, infiltrations, and extravasations, thrombus, infection, and occlusion. This can all happen with IVs, and being clean and making sure that to check the IV site, that it's the transparent tape is on there good, and make sure that's not infiltrated. And flushing the IV is very, very important to prevent these from happening.